Good day, everyone. I am Dr. Denise Romney, DNP, FNP, founder and CEO of Eastern Circle Incorporated. Thank you for tuning in to our Eastern Circle Health Corner. This month's spotlight is on healthy vision and eye awareness, understanding your eye health and knowing when to seek care. We appreciate your continued support and participation. Stay informed, stay healthy. 2020 is normal vision. That means it's a clear vision at 20 feet away from the object that you're looking at. You got no blurriness, no double vision or strain in the eye, and this is normal vision. You got good depth, color, and night vision. That is normal vision. What is abnormal vision? Abnormal vision is when the vision is blurred. You start seeing things blurry. You get double vision. You've seen two things or three, triple vision. You get frequent squinting or headaches, difficulty seeing at nights and reading, or you have a sudden vision changes or eye pain. That is abnormal vision. Common causes of abnormal vision: myopia, which is nearsightedness, that is difficulty seeing distant object clearly, difficulty seeing far. Hyperopia, which is farsightedness, difficulty seeing close objects clearly. That is difficulty seeing close up. Astigmatism is blurred vision due to irregular shape of the cornea or lens. Presbyopia is age-related loss of near vision due to stiffening of the lens. Cataracts, clouding of the lens causing blurred or dim vision, and this occurs common with aging. Glaucoma, increased pressure in the eye, and that increased pressure damages the optic nerve, and it may lead to vision loss. Macular degeneration is deterioration of the macula affecting central vision. And this is common in older adults. Diabetic retinopathy, get damage to retinal blood vessels due to diabetes. This is when the blood sugar is way high and out of control, and this can cause vision loss. Retina detachment, this is a medical emergency. This is when the retina pulls away from the back of the eye, causing vision loss. And this is urgent, and you should see medical doctor right away or go to the nearest emergency room if you have any of this sudden vision loss. The previous slides, we discussed causes of vision disorders. Now we're going to discuss signs and symptoms that you should look out for. Now, glaucoma, you get increased pressure in the eye. That increased pressure damages the optic nerve and may cause or may lead to vision loss. Often, you do not experience any symptoms in the early stages of glaucoma. You would gradually have peripheral vision loss. That means you're not able to see someone approaching from the sides. You only have tunnel vision. You only can see objects coming at you face forward. At advanced stages of glaucoma, you'll get eye pain, redness of the eye, and blurred vision. And this is the advanced stages of glaucoma. Signs and symptoms, disorder for macular degeneration. Let's begin with the definition of macular degeneration. That is deterioration of the macula, the central part of the retina. Symptoms are blurred or fuzzy central vision, difficulty reading or recognizing faces. You see how it's a little different to glaucoma? Glaucoma is peripheral vision is gone. This one is the central. You're not able to recognize faces or having difficulty reading. Your colors may seem dim and straight lines appear wavy. And that is when the macula, the central part of the retina, is deteriorated. Advice is to seek care with your doctor. Discuss with your medical doctor your symptoms and also make an appointment with your ophthalmologist. Let's talk about signs and symptoms of diabetic retinopathy, which is defined as damage to the small blood vessels in the retina. And this is caused by high blood sugar levels. Symptoms: blurred vision, start seeing floaters, dark spots, like little dark spots floating all over the place, even white floaters, difficulty seeing at nights, your possibility of sudden vision loss, and this is in severe cases. But before you get to that point, you have the symptoms of blurred vision, floaters, dark spots, difficulty seeing at nights. Talk about retina detachment. Retina detachment is a medical emergency. What occurs? The retina peels away from its underlying layer of supporting tissue. This is an emergency. What causes this? Aging. That's one of the causes. Trauma is another cause. Trauma to the eye, trauma to the face, sudden blow. Severe nearsightedness can lead to this retina detachment. Eye surgery or diabetic retinopathy, where the high levels of sugar done damage to the retina. Symptoms: what you might feel: sudden flashes of light in one or both eyes, sudden appearance of floaters or increase in the amount of floaters, a shadow or a curtain over part of the visual field. It's like you pull in the curtains, so suddenly shutting the windows. Sudden or severe vision loss. Treatment. Treatments requires this type of symptoms require immediate medical attention. So the advice is to go to the emergency department if you have any of those symptoms. Call your medical doctor, go to the nearest ophthalmologist department. This treatment may require or involve laser therapy, cryopexy, or other type of surgery to the eye. At this point, I would like to reiterate that vision treatment options are eyeglasses or contact lens, LASIK or other surgeries, eye drops and medication, low visual aid for severe loss. When to seek eye care? Again, if you have blurry vision, double vision, sudden loss of vision, flashes, floaters, or halos, eye pain, swelling, or discharge from your eye, go see your medical doctor, make an ophthalmology appointment. Here are some ways to keep your eyes healthy. So we are going to review, as we come to our last slide, we're going to review the 2020 Vision Health Guidelines and key vitamins to assist with healthy vision. Children, eye examination starts at 6 to 12 months, then every 1 to 2 years. Adults 18 to 60 years, eye examination begins. You do this every 2 years and yearly if you're at high risk for eye disease. Adults 60 years and older, vision screen annually. Following the 2020 rules for taking breaks from screens such as computer screens, phone screens, laptop screens, you follow the 2020 rules. That is, every 20 minutes, you look 20 feet away for 20 seconds. The 2020 rules is every 20 minutes, you look 20 feet away for 20 seconds. And use a UV blocking sunscreen to protect your eye and manage chronic illnesses if you do have any. Key vitamins and food sources are, you get that from vitamin A, which you carrots, sweet potatoes, kale. Vitamin E is good for the eye health also. Almonds, sunflower seeds, and spinach, you would get that key vitamins. Vitamin C, oranges, strawberries, bell peppers. Omega-3, you get that from salmon, walnuts, and flaxseed. They all assist in better eye health outcome. And most of all, avoid smoking and manage your chronic illnesses. Example, diabetes, hypertension. Thank you for tuning in. Vision is precious. By staying informed, eating well, getting regular eye exams, and protecting your eyes daily, you can maintain clear sight for life. Ladies and gentlemen, we have come to the end of our health topic. Thank you for learning with us. For more information, please visit the references that is on this slide. The American Academy of Ophthalmology and the Center of Disease Control and Prevention, National Eye Institute, Mayo Clinic, Eye Disease and Conditions, and World Health Organization, Blindness and Vision Impairment. Talk to your eye provider. Please remember to visit your medical doctor, talk to your ophthalmologist, talk to your eye provider. Share this message with someone you love because everyone deserves healthy vision. I am Dr. Denise Romney, DNP, FNP. I am the founder of Eastern Circle Incorporated and the CEO. Thank you for, again, tuning in. Our mission is to educate the adult population on disease management, chronic disease management, health promotion, and disease prevention. Our website is www.easterncircleinc.org. That's www.easterncircleinc.org. Our phone number is 1-800-901-5104. contact 1-800-901-5104. See you next month when we do tune in to bring you another health topic. Stay healthy, share the link, share this message with someone you love because everyone deserves healthy vision.